Now, as the nation gets ready to observe World AIDS Day next month, health officials are beginning to sensitize the public about one of the leading causes of death. Stakeholders in the fight against HIV and AIDS have been working feverishly to get the country to zero new infections. The details in this report. One of the concerns of health officials has to do with discrimination against persons living with HIV and AIDS, while another relates to the number of persons getting tested and treated. They attribute the behaviors to a lack of understanding about the diseases which are often seen as one condition. Clinical Care Coordinator Dr. Amina Goodwin-Fernandez explains the difference between HIV and AIDS.
HIV is just a virus, right? Human immunodeficiency virus. And that virus infects the body and infects specific cells that are responsible for a strong immune system, okay? So over time, when you have a lot of virus replicated in your blood, it kills those cells gradually over time. The body makes more cells, but then as the infection progresses, those cells are killed faster than they can be produced by the body. So then the cell count decreases over time. And so it takes, maybe in some, it might take as few as 2 years in a few cases, but in some people it might take up to 15 years and maybe even 20 years for those cells to decline from normal to a level where now your immune system is weakened. You have immunodeficiency. Basically by then it's acquired immunodeficiency syndrome, right, or AIDS. But most people, we actually get them before they have AIDS.
Dr. Goodwin-Fernandez highlights that persons are today living longer, expanding their life expectancy to the point where the immune system is functioning near normal.
Now we've advanced to a point where we have antiretrovirals that are extremely active, right, with minimal side effects. And so once you take these medications, you suppress the replication of the virus. So when people take the medication, the antiretroviral medication, this medication works to prevent the virus from multiplying in the blood. Okay, so the virus stays dormant in the body. It's not gone because as yet we don't have a cure. But basically the virus is dormant in the body so that the cells in the immune system can survive and keep us with a strong immune system.
The Clinical Care Coordinator points out that persons infected with HIV or AIDS who have lived for years were those who got tested early and adhered to treatment. Asked if the message about HIV/AIDS prevention is getting across to members of the public, AIDS Program Manager Delcora Williams says it is, but with some reservation.
We see more persons coming and getting tested, but I do not think that they're internalizing what they hear. Initially they are scared, they will come, they'll get an HIV test. But the funny thing is, why we know that they're not internalizing what they're hearing, is that you will find that same person after you have counseled them, after you have tested them and they might have received a negative result. You will see that person back in 2 months saying that, you know, either the condom burst or the boyfriend insisted and they had unprotected sex.
The activists encourage members of the public to get tested and protect themselves against HIV/AIDS. For ABS News, Tashika Levan reporting.